Neonatologist at Virinchi Hospital, Vannala Raju. Today, that is October 19th, is celebrated as a World Pediatric Bone and Joint Health Day. So this day is for the awareness, to bring the awareness in people regarding the bone and joint health of the children, that is the growing bones and how to keep them healthy. And shortly Dr. Natesh will be joining us. He is in one emergency surgery. He will be joining us shortly to take the live session, and he and myself will be answering questions, any of the questions that you have regarding the pediatric or newborn child bones, joints related health issues or queries. Few questions we have already received through our parental groups. So let us see, please keep posting your questions whenever you have any doubts. Meanwhile, we'll start discussing regarding the queries some of our parents that had those posted us. So one parent was saying, I have a 2 months boy, and my parents are saying to do vigorous straightening massage for hands and legs to make the hands and legs straight. Is that true? So actually there is no scientific evidence which supports that vigorous massage of the limbs, that is hands and legs at this age particularly. So that there is no scientific evidence to support this. In fact, vigorous massaging of the hands and legs can have adverse effects on the limbs. So that can produce some muscular trauma, some injuries, and even they may produce severe pains and some bleeds inside. So gentle massage with moderate pressure for both hands and feet is always a good thing, because that gentle massage will help in stimulating the growth, will increase the appetite, and will improve the quality of the sleep in these smaller babies. So yeah, there is no scientific evidence to support vigorous massage of the hands and feet in these small babies. So the next question is, dear sir, my child is a 7 months boy and he has a flat back of the head. Will it remain the same? Will the shape of the head be the same throughout? I have not observed any other kids with similar flat shape back of the head. So yeah, so this thing in a 7 months boy, the flatness of the back of the head, it is called as positional plagiocephaly, which is a normal thing usually. So because by this time till this time, most of the babies, the young infants, they lie flat on the bed. So most of the pressure will be applied on the back of the head, because of which slight flattening of the backside of the head is quite normal. And moreover, the skull bones of these small babies, these infants, are soft. So that's why, based on the position, there will be a flattening of the dependent area of the skull. So need not worry about that. This shape will change, and as the baby grows, as more and more out of the bed time baby develops, that means as the baby starts to crawl, move around, and baby starts to sit, stand, then gradually the pressure on the back of the head will be decreased, and the shape of the skull also keeps changing. So unless the shape is very flat and it is worsening even with the child growth, instead of improving, if it is worsening with the child's growth, then yeah, definitely it has to be seen by a pediatrician for the proper evaluation, the growth of the child, and are there any developmental issues in the child, so that it has to be evaluated. If the baby is totally fine without any other issues, the growth is fine, and it is only the flat shape of the skull backside in this age, that can be can be normal, so nothing to worry on it. Just keep observing the shape of the skull as the child grows. And another mother, sir, my boy is 6 years old, and these days he is always complaining of pain in the legs in the night, and he is saying that he is feeling better after the massage is done. Is this because of vitamin D deficiency, or is this because of calcium deficiency? Please explain. So yeah, this This is very common issue which we see in kids of especially this age, the early school going age. So basically, if there are no other symptoms, something like there is no swelling, there is no fever, or there is no rash, or any redness of the joint areas or anywhere in the muscles, then this can be a normal entity which we call it as growing pains. So as the kids grow, they have this growth spurts. That means the time, a place where the growth of the bones and the surrounding areas will be slightly higher. And at the same time, when they are over exhausted or relatively more physically working throughout the day, then that time they may complain of pains of the legs. Vaguely they will complain of pain, especially in the evenings and nights. And this pain, this growing pains, they are harmless and nothing has to be done, and this does not indicate necessarily any vitamin D deficiency or as you asked, calcium deficiency. So this can be normal also. But as I said, so whenever the pain is relatively more, keep doing gentle massages of the hands and legs, or like wherever they complain pain, and just keep observing for the improvement. And in case if the pain is persistent, if the pain is throughout the day, or if you see along with the pain swellings anywhere or the color changes, then that is the time that we have to see whether there is any other issues called like arthritis or myositis or any other rarely seen abnormalities or disorders. If otherwise the baby is fine, growing well, activities are good, and no other clinically or physically visible abnormalities, then nothing to worry. Just see that child is hydrated properly, takes in water adequately, and also whenever he or she complains of pain, do a gentle massage of the legs and the feet wherever he complains. Another parent was asking, are there any specific foods for the height growth in children? So so there is no magic food or magic pill or any particular food category that helps in the growth of the child. So it is always a balanced food, balanced diet that must be concentrated for. So the balanced food that includes adequate amounts of protein and necessary amounts of carbohydrates and minerals, especially calcium and other vitamins, micronutrients. So the growth is dependent on different factors. Basically, the potential of growth is mainly dependent on factors like genetics. That means if the parents are relatively taller, then the kids, their genetics, they make the child to be a little taller. And if the parental height is slightly less, then the height of the child also can be slightly on the lower side. So always a balanced nutrition, balanced diet that includes proper proteins, carbohydrates, and good amount of dairy products which has vitamin D and calcium reserves in it, and green leafy vegetables. So they help better for the proper growth of the child. But as I said, there are, apart from the food, there are many other factors that influence the growth of the child or height of the child. There is one more question. Hello doctor, my 11 years child height is short. Will hanging from the rings from the roof will be of some help? Some height growing powders are available in the market. Will that help us? So again, as I said just now, the height, the final height of the child and the growth of the child and their comparison or the height comparison with the peer group is dependent on different factors, and amongst which especially the genetics is the first thing which will influence the height, and second most important thing is the nutrition of the child, and third thing, any other underlying issues. For example, something like any thyroid issues or parathyroid issues, so they can adversely affect the height of the child, and that can even affect the growth of the child. So as you asked, like hanging from the rings, so there is no proven scientific evidence that it will increase the height per se, but gentle hanging without much pressure on the trunk or the spine, that will help in strengthening the core body muscles. So sometimes what it happens is like that will improve the strength of the core spinal muscles. That in itself will also give an impression of proper growth and proper height. So yeah, gentle exercises that includes things like hanging gently, not with the pressure, or not tying something to the limbs to hang with the rings, and good gentle exercises like swimming also strengthen the core body muscles, and that helps in making the appropriate body posture, and in turn that gives an impression of proper height. And as I said, adequate proper diet is the very important thing, and along with that adequate sleep is one thing which helps in proper growth, because sleep is the time during which growth hormones are released, and if there is any disturbed sleep, irregulated sleep, then that may adversely affect the child. And the diet part, the sleep part, and the exercise. Yeah, the physical activity of the child also plays a major role in the growth or the height of the child. So kids, those who are more sedentary, those who are more used to the mobile games or sedentary works and only indoor activities, then the growth rate will be a little less, and even we can say the final height during the growth spurts also, that can also get adversely affected. So proper outdoor activity, physical activities, exercises like swimming, and proper diet will help in attaining a better growth and better height of the child. Hello sir, my child is 10 months old, and we are using walker, but I saw that walker is not recommended. Is walker good or bad? No. So yeah, scientifically speaking, walker is not recommended at all. So the walker, in fact, it does not help in walking. That will even further delay the walking ability of the child, because when the child is put in the walker will not allow whole body of the child to be borne by the legs. So that is a time when the child will not learn to balance his own body or her own body on the legs. So which will increase the time to learn proper balancing and to learn proper walking. So there is a delay in the walking, but not faster walking. And second thing, walkers are more prone for the issues like traumas, falling from the walker, and issues like reaching out to the dangerous objects, something like any hot fluids or liquids or any sharp objects, whichever they are there. Then the kids, they tend to go near to that place and acquire them, which can be injurious to the child. So using walker is not good in both ways. It will not help in faster walking ability, and second thing, that in itself can cause other walker related traumatic injuries. So we do not recommend walker. And yeah, in case if you feel like some support needs to be given, it is always good for us to hold the baby's hand or let the baby hold our finger and make them cruise around. And but not this walker where the baby made to sit in the walker and move around. So one more question from Instagram just now we got. So hello sir, my child is 1 year 2 months and his legs are bent outwards. Is it normal? Yeah. So this is very common question that we come across during our clinic hours. So where the child is absolutely normal, there are no other health concerns, but the child legs are bent outwards like in this shape. So they keep walking like this. So many parents, they have this concern. But yeah, so if there is a small degree of bending outwards, bowing of legs, that is quite common. This is called physiological bow legs. That means normal bow legs during the growth of the child. So over a period of time, as the child grows, this bowing of legs will be straightened up gradually, and that will remain proper. But this bowing of legs, if they are gradually worsening more by the age of 2 to 3 years, then that is the time where we should be worried. So this just gentle bowing, which is gradually coming to a normal state by the end of 2.5 to 3 years, this is normal. And there is another part, this is as you asked, this is a bowing legs. There is another part called physiological knock knees. That means instead of outside bowing, the knees will become like this. So the inside knock knees. So even this is also normal, and this usually we see at around 2.5, 3 years to 4.5, 5 years also in some cases. So both legs will actually become straight to the adult posture only by the end of 5.5 to 6 years. So physiologically, that means normally also, there is some extent of bowing of legs, and at a later stage of life, that means after 2.5 to 3 years, there is a physiological or normal state of knock knees also. Both are normal. Yeah, there is one parent was asking, constipation का भी बताइए sir. Yeah, again, constipation is a different issue altogether. So basically, constipation at different ages can be because of different reasons. So usually क्या है कि पहले अगर जब हम जैसे आपने हिंदी में पूछे, so I will be telling in Hindi. So constipation at different ages. जैसे अगर 6 महीने के बाद जब हम solid foods शुरू करते हैं, तो फिर उस टाइम पे इंटेस्टाइन, जो ग्रोइंग इंटेस्टाइन है, जो आंतुड़ियाँ हैं, सो वो एडजस्ट होने में थोड़ा टाइम लगेगा, और उस टाइम पे है तो लूज मोशंस होगा, नहीं तो कॉन्स्टिपेशन भी होने का चांस है. और लेकिन अगर ये फूड जब चेंज करते हैं उसी टाइम पे है, तो इमीडिएटली फूड में बदलाव करने का ज़रूरत बिल्कुल भी नहीं है. आप फूड कंटिन्यू कीजिए. अगर कंटिन्यू करने के बावजूद भी कॉन्स्टिपेशन वैसे ही कंटिन्यू हो रहा है और वर्सन हो रहा है, तो तब बिल्कुल चेक करना पड़ेगा, क्योंकि कॉन्स्टिपेशन के वजह हो सकता है कि अंदर इश्यूज, इंटेस्टाइन का इश्यूज, जैसे कुछ थायराइड का इश्यूज हो जो इंटेस्टाइन पे असर आते हैं, नहीं तो कुछ इलेक्ट्रोलाइट्स का डेफिशिएंसी हो, वो पूरा भी चेक करना पड़ता है. और वो कॉन्स्टिपेशन भी रिलीव करने के लिए एक चीज़ क्या है कि बेबी का, जो चाइल्ड का डाइट में एडिक्वेट फाइबर होना चाहिए और वाटर एडिक्वेटली देना चाहिए. अगर फाइबर नहीं है तो बवल मूवमेंट्स भी उतना ठीक नहीं होगा, और साथ साथ अगर वाटर, पानी कम पिए तो भी अंदर जो मोशन में जो भी वाटर है वो इंटेस्टाइन से अब्जॉर्ब होके मोशन और भी हार्ड होता रहेगा, और वो कॉन्स्टिपेशन और भी वर्सन होता रहेगा. तो इसलिए चाइल्ड के डाइट में, बच्चा के जो भी खाते हैं उसमें फाइबर होना चाहिए, जैसे लीफी वेजिटेबल्स हो, सब्जियां हो, नहीं तो कैरेट हो, नहीं तो फ्रूट्स हो, फ्रूट जूसेस हो विद पल्प. सो वो सारा भी देना ज़रूरी है कॉन्स्टिपेशन अवॉइड करने के लिए. और दूसरी चीज़ क्या है कि डेली टाइमिंग एंड टॉयलेट ट्रेनिंग. सो टॉयलेट ट्रेनिंग भी टाइम पे करना है. ऐसा है कि व्हेन द चाइल्ड इज मोर देन 2.5, 3 इयर्स होते ही उनको टॉयलेट पे मतलब कैसा बैठना, कैसा पोस्चर लगाना और किस टाइम पे टॉयलेट पे बिठाना, सो ये सारा भी एक आदत करवाना चाहिए, ताकि उनके अंदर का सिस्टम भी एक टाइम शेड्यूल पे आ जाते हैं और कॉन्स्टिपेशन का चांसेस कम हो जाते हैं. Yeah, I think that answered your question. And another parent in the group was asking, like, my child doesn't drink milk at all. Will it cause any problem? Will this affect his bones? Yeah. So you did not mention the age of your child, but yeah. So basically, if we look at the diet of any child, so if we take the gastrointestinal system per se, so it will be almost like, it will mature to almost like an adult intestine or gastrointestinal system by roughly around 2 to 2.5 years of age. So till that time, the intestine, it keeps maturing, and the dependency or the necessity of milk will be more during this age only. So that means once the child crosses 2 to 2.5 years, the nutritional role for the growth and internal systems the nutritional role of milk is significantly less once the child is more than 2.5 years, or even let us take as 3 years. So if the child doesn't drink milk, that is not going to harm, because there are many other food products that can give adequate amounts of calcium or vitamin D. So something like yogurt or curd, or maybe the nuts, or different types of fruits, and even legumes, vegetables. So all these things, they do have vitamin D and calcium in adequate proportions. So if the child is not consuming milk, you need not compel the child to drink milk, but instead you see that adequate amount of other foods which have this vitamin D are consumed by the child. So see that the child is properly taking other foods. So especially main thing what we see is food fuzziness. So kids will be picky eaters. They try to eat more of the junk, but they do not eat our regular foods. And when we offer some fruits or vegetables, they tend to avoid them and they do not eat. So that is also one concern. And when they eat more and more junk, that will have more and more effect on this their overall intestinal system and growth. So see that there is always a balanced diet which the vegetables and fruits are given adequately and properly. And one important thing when we talk about food fuzziness, to make the child accept all the types of foods, see that deworming is done on a timely basis, because these kids, especially toddlers, they just walk around, roam around, keep all the dirty things in the mind, in the mouth, which has a tendency to catch intestinal worm infestations. So that worm infestation also can decrease the appetite of the child, and they may become cranky, and they tend to avoid the regular foods that we consume, and that suppresses the appetite, and even that disturbs the sleep also. So see that on a timely basis, whenever you see any of these features, you just meet your pediatrician for a proper assessment, so that your pediatrician can help you with deworming, and if any other investigations are necessary, that can be done. So there is one more question. One of the parents were asking, what are some examples of musculoskeletal conditions in children? Yeah. So coming to musculoskeletal conditions, so it is basically a broader term, because there are so many things which are termed or categorized into this group of disorders. So diseases or disorders that affect the bone, diseases or disorders that affect the joints and the surrounding structures, that means either the ligaments or even the muscles that are involved. So those diseases or disorders are called musculoskeletal conditions. So let us discuss a few commonly seen musculoskeletal issues in children. So the main thing, and which is more dependent more dependent on the diet in a growing child, is vitamin D deficiency rickets. So basically, when the intake of vitamin D is less, may it be through the dietary source, may it be because of the restricted physical activity and outdoor activity of the child. So sometimes they will be deficient in the vitamin D. And especially in these scenarios, or in these days, the supplementation of vitamin D in the infancy is very much essential, because the levels of vitamin D have seen to be significantly coming down because of the changing lifestyle. So when this vitamin D is deficient, that in itself also will lead to deficiency of calcium. That will lead to a condition called rickets, which affects the bones. So where the bone mineralization will be decreased and the bone's shape will be distorted, and that will adversely affect their overall growth and development also. So this is one of the commonly seen musculoskeletal condition. And other musculoskeletal conditions, relatively what we see in older children, kids, is something called arthritis. So basically, this arthritis means it is the inflammation of the joints. So usually, what happens is, like in these conditions, in a few proportion of the children, when they have some other infections, maybe some urinary tract infection or some other viral infections, they can trigger the joints to become inflamed. So that is the time where the kids will have some swollen joints, painful joints, and they'll be unable to walk or move, and they will have restricted movements of the involved joints. So this is one more relatively commonly seen musculoskeletal condition that we see as a post-infection reactive arthritis, or sometimes even because of the genetic predisposition also, they may land up with other set of arthritis which are because of autoimmune conditions or secondary to or triggered by inflammatory conditions triggered by some infections. And if we talk about a few other relatively genetic causes of musculoskeletal conditions, then there are few diseases like achondroplasia, which is an abnormality of the bone structure inside that will affect the overall height of the child, and that will another muscular condition called spinomuscular atrophy, which is also a genetic condition where the muscle junctions they get involved, because of which child will not be able to control their muscles properly. Yeah, one more question just received in Instagram. So preschooler ఎముకలకు ఏమి జరుగుతుంది? ఓకే, అంటే మీరు ప్రీ స్కూలర్ అంటే మనము ఏజ్ కేటగిరీ లైక్ 5 years కానీ అంతకన్నా తక్కువ మనం ఎస్టిమేట్ చేసుకోవచ్చు. అయితే ముఖ్యంగా ఈ ప్రీ స్కూలర్ అని ఈ ఏజ్ అనేది, ఈ ఏజ్లో గ్రోత్ అనేది చాలా ఎక్కువగా ఉంటుంది. అది ఎముకలు కావచ్చు, లేదంటే కండరాలు మజిల్స్ కూడా కావచ్చు. సో వీళ్ళల్లో ఈ ఒకవేళ వాళ్ళు తీసుకునే డైట్లో మనకు విటమిన్ డి కానీ, కాల్షియం కానీ, అదర్ మైక్రోన్యూట్రియన్స్ కానీ తక్కువ ఉంటే దాని ఎఫెక్ట్ చాలా ఎక్కువగా కనపడవచ్చు ప్రీ స్కూలర్స్లో. అండ్ వీళ్ళ ఎముకలు సాఫ్ట్ ఉంటాయి. మనకు అడల్ట్ అంటే ఒక పెద్దవాళ్ళ ఎముకల్లాగా గట్టిగా అలాగా ఉండదు, వాళ్ళ ఎముకలు కొంచెం సాఫ్ట్గా ఉంటాయి. సో కాబట్టి వాళ్ళకు ఫ్రాక్చర్ అయ్యే ఛాన్సెస్ తక్కువ ఉంటాయి. బట్ అట్ ద సేమ్ టైం వాళ్ళకు సరైన ప్రపోర్షన్లో ఆహారం కానివ్వండి, లేదంటే వాళ్ళ ఫిజికల్ యాక్టివిటీ ప్రాపర్గా లేదనుకోండి, అప్పుడు ఎముకలు స్ట్రైట్గా ఉండకుండా కొంచెము అటు ఇటు బెండ్ కూడా అయ్యే ఛాన్సెస్ అనేటివి అయితే ఉంటాయి అనమాట. సో అందుకని ఈ ప్రీ స్కూల్ ఏజ్ గ్రూప్లో ఎప్పుడైతే మనకు గ్రోత్ ఎక్కువగా ఉంటుందో ఆ టైంలో ప్రాపర్గా న్యూట్రిషన్ ఇవ్వడము, అంటే ఆహారం ప్రాపర్గా తీసుకునేలా చూడడము, ఫిజికల్ యాక్టివిటీ కరెక్ట్గా ఉండడము, అండ్ ఎండ ఎక్స్పోజర్, సన్ ఎక్స్పోజర్ కనీసము యావరేజ్, అంటే ఇప్పుడు మనకున్న ఇండియన్ కండిషన్స్ని బట్టి చూసుకుంటే ఆల్మోస్ట్ యావరేజ్గా 20 to 30 minutes అనేది పర్ డే మోడరేట్ సన్ ఎక్స్పోజర్ ఉండడము, ఇవన్నీ కూడా చాలా ఎసెన్షియల్. వాళ్ళ ఈ ప్రీ స్కూల్, ఎస్పెషల్లీ ప్రీ స్కూల్ ఏజ్ గ్రూప్లో వాళ్ళ బోన్ గ్రోత్ కానివ్వండి, మస్కులోస్కెలిటల్ గ్రోత్ కానివ్వండి, అవి చాలా ఎసెన్షియల్. అండ్ పిల్లల ఎముకలు కాలక్రమేణా ఎలా మారుతాయి? రైట్. సో ఇది బేసికలీ పిల్లలు వాళ్ళ పిల్లల బోన్స్ అనేవి దే ఆర్ డైనమిక్, అంటే ఒకే విధంగా ఉండవు, అవి మారుతూ ఉంటాయి. సో వాళ్ళ బోన్స్ చూసుకున్నట్టయితే మనకి ఇది ఒక షాఫ్ట్ అంటాము, అండ్ పైన అంటే ఇప్పుడు ఫర్ ఎగ్జాంపుల్ ఈ లాంగ్ బోన్ ఉందనుకోండి, సో ఆ బోన్కి పైన కింద గ్రోత్ ప్లేట్స్ అని ఉంటాయి అన్నమాట. సో ఈ గ్రోత్ ప్లేట్స్ అనే వాటి వల్లనే ఎముక పెరుగుతూ వస్తుంటుంది. అయితే ఈ పెరగడం అనేది కూడా స్పర్ట్స్ లాగా వస్తుంది, అంటే ఎవ్రీ టైం సంవత్సరం పొడుగుతా లేకపోతే వాళ్ళు పుట్టినప్పటి నుంచి అడల్ట్ అయ్యేంత వరకు ఒకే విధంగా పెరగదు. సో పలానా పర్టికులర్ టైంలో ఒక్కొక్కసారి ఎక్కువగా పెరుగుతూ ఉంటుంది, అండ్ కొన్ని టైమ్స్లో పెరుగుదల కొంచెం తక్కువగా ఉంటుంది. సో ముఖ్యంగా మనకు 5-6 years ఏజ్ గ్రూప్లో ఒక గ్రోత్ స్పర్ట్ ఉంటుంది, అండ్ అగైన్ 7 to 8 years అప్పుడు కొంచెం గ్రోత్ స్పర్ట్ ఉంటుంది. మళ్ళీ అడాలసెంట్ అంటే కిషోర దశకు వచ్చిన తర్వాత మళ్ళీ అప్పుడు కూడా వాళ్ళ ఫైనల్ గ్రోత్ స్పర్ట్ అనేది ఉంటుంది. అంటే ఆ గ్రోత్ ప్లేట్ నుంచి ఎముక ప్రాపర్గా ఫామ్ అయ్యి వాళ్ళ గ్రోత్ అనేది ఇంక్రీజ్ అవుతుంది. సో ఆ ఈ గ్రోత్ ఇంక్రీజ్ అవుతూ ఒక అడల్ట్ స్థాయికి వచ్చిన తర్వాత, ఒక పెద్దవాళ్ళలాగా బోన్ ఫామ్ అయిన తర్వాత బొక్క పెరగడం అనేది ఆగిపోద్ది. కేవలం అందులో కాల్షియం అనేది డిపాజిట్ అవుతూ స్ట్రెంగ్త్ మాత్రమే ఉంటుంది అనమాట. మళ్ళీ ఇది ఇంకొంచెం వాళ్ళు వృద్ధాప్యంలోకి వచ్చేసరికి ఇందులో ఉన్న కాల్షియం కానివ్వండి, కొంచెం కనెక్టివ్ టిష్యూ కానివ్వండి, మెల్లిమెల్లిగా వాళ్ళ హార్మోనల్ చేంజ్ వల్ల, ఏజ్ వల్ల అది కూడా రిజాల్వ్ అయిపోతూ ఉంటుంది. సో దాన్ని మనం ఆస్టియోపోరోసిస్ అంటాము. అండ్ పిల్లల్లో బోన్స్ అనేవి ఒక అడల్ట్ బోన్ లాగా ఉండదు. సో అది కొంచెం సాఫ్ట్గా ఉంటుంది, అండ్ డిఫరెంట్ స్టేజెస్లో, డిఫరెంట్ ఏజ్ గ్రూప్స్లో ఒక్కొక్కసారి ఎక్కువగా పెరుగుతుంది. మనం నోటీస్ చేస్తాం, ఒక్కొక్కసారి పేరెంట్స్ మనతో చెప్తుంటారు, సార్ 6th classలో చాలా చిన్నవాళ్ళు అనిపించాడు, 7th సడన్గా చాలా పెద్దగా అయ్యాడు అనిపిస్తుంది అని. సో దిస్ ఈజ్ వాట్ అది గ్రోత్ స్పర్ట్. మళ్ళీ అట్ ద సేమ్ టైం మనకు సంథింగ్ లైక్ ఇంటర్మీడియట్ అవుతున్న తర్వాత వాళ్ళకి ఏదైతే వాళ్ళ అడాలసెంట్ ఏజ్ గ్రూప్ వస్తారో అప్పుడు కూడా వాళ్ళకి ఆ గ్రోత్ స్పాట్ అనేది ఉంటుంది. అండ్ ఒకసారి ఆ అడాలసెంట్ గ్రోత్ స్పాట్ అయిపోయిన తర్వాత వాళ్ళ బోన్ అనేది ఒక అడల్ట్ నార్మల్ పెద్దవాళ్ళ బోన్ ఎలా ఉంటుందో అలా మెల్లిగా ఫామ్ అవుతుంది. సో ఈ చేంజింగ్ బోన్ ఉంటుంది కాబట్టి ఖచ్చితంగా డైట్, ఫిజికల్ యాక్టివిటీ అనేది చాలా చాలా ఇంపార్టెంట్. ఆ గ్రోయింగ్ బోన్ అందుకనే స్పెషల్ కేర్ అనేది తీసుకోవాలి. Yeah. So I think any more questions? No. Okay. So thank you so much, parents. That was a wonderful session discussing, and so many important things have been discussed. And I'm very happy to resolve as many as possible questions or doubts of you. And if you have any further queries, please reach our team. Please drop in your queries. We'll be more than happy to answer them. And if you need any consultation or if you want any physical evaluation of the child, so definitely we will be more than happy at Virinchi hospitals to help you. Thank you so much. Thank you.